Do you hear your baby or child snore during sleep? Are you quick to respond an emphatic yes when the pediatrician asks if your child snores at night? Or do one of the child's siblings keep complaining that the snoring is keeping them up at night? When do you as a parent worry about snoring? Are there short-term problems, long-term problems, and when should you see the pediatrician? So let's start off by mentioning snoring is common and most kids will do it at some point in their life. Sometimes they're extra tired and getting deeper sleep, they will snore, sometimes in a certain position or when they're sick with a cold. When do you actually worry, or when do I worry as a pediatrician? If I hear about gasping, catching or holding a breath, that gets my attention. If they breathe through the mouth, they're that mouth breather, less through the nose. Speaking of the nose, if I see the nostrils open in and out, we call that flaring. That means the child is working harder to breathe, and that gets me worried. If there's these pauses called apnea, and they last more than a few seconds or happen several times at night, I get more concerned. Same if there's coughing with snoring, or if the child or their siblings are waking up a lot due to snoring and no one's getting good sleep. We look at the lips, blueness in the lips, the face turning red or white, that's more of a concern. When the child is sick, if snoring is accompanied by fever, drooling, and trouble moving the neck, that's actually more of an emergency. And then finally, in infants and babies, if they're snoring and they're spitting up, they're arching at the back, and there's more crying with the snoring, that could be reflux that deserves attention. So for the kids who snore, once in a while and none of the above issues, less of a concern. How could snoring affect children's health? Snoring usually comes from blocking of the upper airway, the nose, the mouth, the throat, the neck, and the vocal cords. So any snoring that is accompanied by illness, holding a breath, gasping, lips, face turning color could be a more serious problem with this airway. If you hear or see of these things, immediately seek medical care. For those kids who snore night after night, they might have abnormal teeth development, they might have speech issues, they might have behavior issues from lack of sleep, also with parents and siblings could have the same problem. They may get irritable, they get moody, they might have less flexible behavior. Higher risk for accidents, injuries, attention issues, depression, anxiety, because they're just not getting enough sleep. They're not ready to attack the next day physically or emotionally. So again, if you've got a child who snores on a regular basis, please give us a call. If you have a child with speech issues, teeth issues, attention issues, have a talk about snoring. In fact, when I see kids who are having issues with school, one of the first I talk about is sleep and snoring. What can we do to help you and your family with snoring? If it's a baby or infant, we look at that reflux or spit up, and that's where milk of formula and or stomach acid comes into the throat. We may change positioning of feeding, we may thicken feeds, we may even use medications to help reduce reflux, reduce snoring, and make everybody sleep better. In kids who are older, more common causes of snoring include larger tonsils or adenoids in the back of the upper airway. We will look at your child. We may get an x-ray of the soft tissues of the neck, and we will look for airway narrowing. If we think that's a problem, we may get our ear, nose, and throat colleagues involved. And to be honest, parental and professional experience with adenoid removal for snoring can help with major improvements. We all slept better when one of my kids, who will remain nameless, had his adenoids removed. He didn't snore, he slept better, and we were all happier. Chronic snoring can also come from chronic nasal congestion due to illness or environmental irritants or allergens. So we can test and identify those things and make changes in the bedroom, in the environment, and maybe even use medications to make those problems go away. If we have a child who keeps snoring despite these efforts, sometimes we can do a sleep study to find different ways to help with airway blockage and help with sleep. So again, if you aren't sleeping, your child's not sleeping because of snoring, don't lose another night of good sleep. Give us a call. Let us help you sleep better. Let us help you with snoring.